Hello, everybody. Welcome, welcome. Happy National CHW Awareness Week. Happy National CHW Awareness Week, everybody. Let's get some hearts going. Let's get some hand claps going. How y'all doing? Type in the chat where you are logging in from because we want to hear from you. We are so excited to have you guys in the virtual room. So let me see those hearts going. Let me see those hand claps going. I see everybody coming in the room. Drop where you're coming from. We have Louisiana, Eagle Pass, Texas, Detroit. Oh, it's going fast. North Carolina, Minnesota. How y'all doing? How's everybody doing? Maine, Massachusetts, New York, Wisconsin. Keep it going. Keep it going. Thank you guys so much for being here today. I see the hearts. I see the hearts. Hey, Sarita. Hey, Rosemary. Ernesta. Hey, how you doing, Terry, Alicia? How are you guys? So excited to have you guys on the call. My name is Tasha Whitaker, and I'm the CHW Network Manager here with Nashua. And I would like to officially kick off and welcome you guys to our National Community Health Worker Awareness Week webinar. Thank you guys so much for being here. And shout out to everyone that is doing the work. We're so excited to have you guys here. I am now going to pass it on to our amazing interim ED, Miss Catherine Martinez.
Hi, everybody. Oh my God, I was just saying right before we got on, can you all believe we were at Unity just a few weeks ago? Most of us all together in person, coming on the heels of all of that excitement. And here we are on National CHW Awareness Week. I just want to underscore that this is the third year, guys, right? Like, this is the third year we're representing. This is the third year that we see so much organizing happening on a local level. We see folks collaborating. We see folks celebrating and commemorating all the amazing work that community health workers do in all of these different communities, the diversity, the uniqueness, the self-determination of so many of us as individuals, and the collective action that we put into supporting this amazing and critical workforce. So all the flowers, all the love is all this week dedicated to you. And we know it goes way beyond just a week of awareness around the impact of this profession. We know it goes way into the communities, it goes way into the families. We are a critical part of all things that have to do with connecting so many amazing folks to and giving them access to health services and support. So shout out to every single one of you. We're celebrating you today. We're celebrating you tomorrow and Wednesday and Thursday and Friday. And we will continue to go beyond just celebration, but continuing to find ways to really preserve this workforce and continue to advocate for long-term sustainability because nobody does it like CHWs and nobody will ever be able to do it like a CHW. So I'm super excited about the roll call, the representation. We have shown up today. I hope you guys can feel me transmitting this excitement to you all. And I'm really looking forward to seeing all the different events that you guys are putting together. I've already started to take a peek of some folks that have submitted some of their events to us. Super excited. There's just so much happening nationwide. And we know energies could be a little bit low. We're all going through a little bit of a transition, trying to figure out so many pieces. But one thing that cannot be left out of all of this is the spirit of community health workers. So thank you all. I will be brief, and congratulations on our third annual National Community Health Worker Awareness Week. I'll pass it back to Tasha.
Thank you so much. And we can go to the next slide, Aurora. This is just a brief overview of our event today. So we just had our welcome. We're going to talk a little bit about National CHW Week, the resolution, the resources that Nashua has available for you for this week. Also, we're going to hear some encouragement from some of our great partners, and then we'll open it up for Q&A, and we're going to let you guys enjoy the rest of your day. Next slide. For anyone that is new here about Nashua, we were founded in 2019. You guys know that we have our pillars of amplifying, articulating, being an ally, advancing, being an advocate, and activating. That is what being a CHW is all about, and that is really what Nashua is about having this platform to leverage and amplify the workforce. And so we really hope that you guys are doing that this week for National CHW Week. Next. Again, like Catherine just said, the mission of National CHW Week is to amplify. And so we have all of these tools, social graphics on our website where you can go and download them and share them out, disseminate them out to your community. And just know that this third annual National CHW Awareness Week campaign will support CHWs and our amazing allies to raise awareness of the CHW profession in their community. And next, I'm going to hand it to Miss Angie, who is going to talk about the resolution.
Hey, what's up, everybody? Welcome to Awareness Week. I'm so glad to see everyone here. My name's Angie, she, her, CHW based in Portland, Oregon. I work for NACHWA as the Policy and Advocacy Manager. And I'm letting you guys know about the third annual congressional resolution supporting the designation of this last week of August here as National CHW Awareness Week. So if you'd like to see what that text looks like, you can scan the QR codes. They are the same text. It's just one's the House version, one's the Senate version. And quick little plug, it's not too late to meet with your lawmakers to talk about asking them to co-sponsor this resolution. It doesn't change any laws. It just asks them to acknowledge the workforce and the work that we do. And it can be a great way to start, continue, or deepen your relationship with your elected officials that doesn't have any money attached to it. So it's a pretty easy ask and a really, kind of good way to get started if you're new to advocacy or if you've been involved a long time. Great way to keep the work going. You can reach out to me for more information about that. If you want support, we have all kinds of tools to make it super easy for you. But then let's talk about, next slide, please. Who is, oops, sorry, next. I thought I deleted that one. Thank you so much. Here are our sponsors for this year. We have double the number of co-sponsors than we had last year. So we have, on the House side, Representative Raul Ruiz of California, once again being our lead sponsor. And then this year we had our guy from Oregon, Ron Wyden, and we have a couple folks on the call who participated in our Hill Day in 2024 and 2025. Jada, I know, is here. Dede, I know, is here. And these folks have laid the groundwork with conversations with Senator Wyden. And now look, this year he's our lead sponsor. So I'm probably already over time, but if there's any other members of Team Morgan who've snuck on the call, please raise your hands, throw up an emoji, but I'll pass it over to, I think, Catherine.
It'll go back to me. So let's talk. No worries. So let's talk a little bit about what are some of the resources that we have for this week. So this is our schedule for the week. We have themes this year, so every day there's a different theme. Today we're focusing on the webinar, so you're getting the tools today, the information. We'd also love for you to go to the CHW Connector app. Any events that you have, there is a special group that you can post that information to promote it to CHWs all over the country. It's free, so definitely go check that out. Post your event in that group. You can also, on tomorrow, we'll be talking about repping your state CHW Awareness Day. We totally understand that different states are at different stages of the CHW workforce. And so some states have different days other than this week. And we want you to promote that, talk about that so that you can educate your community, but also so that you have that time to let people know the work that you've been doing, how they can support you, and lean in and be a good community partner. Then on the 27th, we are going to have a Facebook Live with one of our partners, Culture Care Company in Hawaii, CHW Association, on Facebook Live, where we'll talk about some of the non-traditional ways that CHWs are being implemented into the workforce. And Hawaii CHW, actually this month, they're celebrating CHW Awareness Month all month long. So they will share with us some of the strategies that they have implemented to bring awareness to their state and to their community. On the 28th, CHWs will take over LinkedIn. If you have not set up your profile already, we definitely encourage you to do that. We will be sharing and tagging employers about the work that their CHWs are doing, how they're utilizing the CHWs in their healthcare systems, in their CBOs. We want to hear your stories all on LinkedIn on the 28th. So make sure that you guys are tagging using the hashtag so that we also can see those stories and reshare them. And then the last day of the week, we will be having the CHW and Ally Storytelling Day. We have 2 graphics that you can utilize and upload and share your story. So as you can see, there's a variety of different ways that you can get engaged. We have still on the website templates from past years that you can leverage. So those of you meeting with your lawmakers, utilize those toolkits because they are very helpful. We have agendas, roadmaps, a lot of different resources on the website that you can leverage. So we hope that you guys utilize that information. Next. Again, these are some of the other ways that you can participate. So this is an example of that graphic that I just mentioned of storytelling. So tell your story. You can schedule meetings in person, post on social media. Guys, it doesn't have to take any money. This is all things you can do for free to leverage, to amplify, to articulate the value that CHWs bring to the public health workforce. Next slide. And next, we are going to hear from some of our partners, and I'm going to hand it over to Catherine to lead that discussion.
Thank you so much. Thank you so much, Tasha. All of this work that we do and all of the collaboration that really goes into the celebration of CHWs, but also just thinking about the long-term sustainability really stems from the strong support that we receive from our partners. Next slide, please. So, the slide's not there. So I wanted to take the time to really thank some of our partners who have really helped us drive this work beyond so many areas that we could think of. So a special shout out to Sanofi for walking us through what has been an incredible tool that is helping inform all of our advocacy, so much of our lobbying and the relationships that we're building, and making folks aware of what is the strength of public health workers and how they can collaborate with community health workers to drive so many amazing outcomes. This report has been amazing because it's been not only including CHWs, but CHWs actually have a voice. So we have been able to really partner in a way that speaks to the authentic ways that we expect partners to happen, to collaborate with CHWs, to have our voices heard, and to allow us to have the diversity and the representation around anything that has to do with CHWs. Our founding executive director used to say, if it's not with us, it's not for us. And I think that's really important because we're continuing to make sure that we are part of these conversations and we are part of the work that is shaping the future of CHWs is the only way we want to continue to align with our partners. So thank you so much to Sanofi for your support.
And now we'll bring Barb up if you would like to say a few words.
Hi, everyone. We were absolutely humbled when we were asked to take part in this day in any way. So thank you so very much. Huge shout out to everyone in the Nashua community, to the staff, to the founders, to the board members, all of you, past and present, who have done so much to unify the workforce, and of course, all of you in community who do so much to ensure the well-being of our neighbors. We wanted to just say a little bit about this report. It was it was really important to us to work alongside all of you at Nashua and CHWs and community, along with Atlas Clarity and Nation Swell, to try to understand how we could do better in terms of supporting CHWs and what are some of the actions that we could be taking to be better partners. And so there will be a press release tomorrow announcing the report. That's a press release that Nashua will issue, and that all of us are supporting. And we hope the report is a tool for you that will help you as you seek to gain support for your work wherever you are. There are a couple of call to actions in the report that I wanted to share, and they are to please partner with state and local CHW networks and associations on policy priorities, while also ensuring increasing direct investment and sustainable CHW programs and partnerships locally. So ensuring that we're partnering with state networks and partnering with local networks and supporting, directly supporting the work of CHWs and community. The second one was design full-time permanent care team roles for CHWs that are informed by CHW expertise, ensuring that the unique value of the CHW is preserved for optimal program impact. The third is bring in CHWs early as possible, as paid consultants. I'm sorry, number 2 was design full-time permanent care team roles for CHWs that are informed by CHW expertise, ensuring that the unique value of the CHW is preserved for optimal program impact. The third one is bring in CHWs early as paid consultants and service providers when assessing community need and developing and implementing local programs. The fourth one is support Nashua and its unification of the workforce, their training and professional development of CHWs, their support of state and local CHW networks, and their policy and advocacy work. And the last one is to support research and data that continues to earn the support and funding of CHWs wherever they are. So we hope that you'll use it, and what we also hope is that you'll provide us feedback. We consider it not an authoritative document. We consider it a discussion starter and a beginning so that we can learn, and there will be lots of invitations to hear from you in the fall related to this. So happy CHW Awareness Week, and thank you for all you do.
Thank you so much, Barb. And I really want to thank Santa Fe also for being a great partner in support and funding those CHW networks that are utilizing those funds to be able to disseminate information out this week. And so we really, really thank you for that support, and the networks, thank you for that support, because that's such a huge, huge help for those networks on the ground doing the work. So we really thank you for being a great partner. Next, I would like to call up Marlon with Vaccinate Your Family.
Hi, thank you. I definitely want to start off by thanking the opportunity to be here with everybody today and celebrating our week. I want to say also thank you to Barbara and her team, just really for giving us that voice, right? As community health workers, we do know that it is something that we still have a lot of work cut up for us, right? Like just letting people who we are and what it is that we do. So I definitely want to encourage everyone, especially this week, to continue looking for those partnerships in your community, to continue looking for those that will help us raise our voice, because it's a reminder, right, that our work is work that we do out of love, right? Out of love for our communities, out of love for everybody that we service. I want you to remember that our stories is what make us who we are. So the more we are united, especially this week, and share what we're doing in our communities, remind people of what our work is, that's going to give us more power, and it's going to make us more powerful, and for people to continue to see us as the go-to people in our communities. this week, right, we celebrate ourselves, but I also want you all on this call to take the time and just remember to take care of yourself, right? The work that we do for our community, sometimes we place our community first, and we might tend to forget a little bit about ourselves and how valuable we are. So aside from giving a heart and giving a high five, a hug to all your community health workers, make sure you take the time to do that for yourself as well, because it is a week to be proud of who we are, to be proud of our communities, but also to be proud of everything that we've done as a community ourselves. I also want to make sure that aside from the activities, you guys participate in the activities as much as you can. It is how we grow, right? By supporting each other. And I really just want to close off by saying that never forget to celebrate who you are and never forget to celebrate your story itself and always be a supporting system to each other. A todos los promotores de salud les mando un abrazo all the way from Eagle Pass, Texas. Y aquí estamos para que lo que nos podamos servir uno al otro y cuidarnos uno al otro también. So again, congratulations to everybody. Be proud of what you are, be proud of what you do, and make sure that our voice is heard. Have a great week, everybody.
Thank you so much, Marlon. Thank you so much. We appreciate that. And I also am going to call up Lily Fox, who is Nashua's board chair. If you can give us a few words as well of encouragement. Lily, is you here? All right. Well, we're going to keep it moving. So this is our next event that is coming up. We will have a Facebook Live with Culture Care Co., where they will be talking about implementing CHWs into the healthcare setting in a non-traditional way. And we'll also be talking with Chauncey, who is the lead for the Hawaii CHW Association. I'm super excited to have this Facebook Live conversation with them. So you guys join us virtually on Wednesday, and we hope to see you guys there. Next up, we would like to share with you guys some updates just from this National CHW Week thus far. So today we had about a little over 300 people registered participants. We do have those resources and toolkits available on the website. We still have the ones from past years available. So if you would like those, you're welcome to check those out. And how are you participating in National CHW Week? We have that form up. I think right now we're a little bit over 80 or individuals that have submitted different ways. Some of you guys are doing some really cool things. So I'm really excited to see the different areas in which people are amplifying the CHW Week, as well as promoting your activities on the CHW Connector app. So that's a great way to connect with other CHWs as well. And so right now we're going to open it up for Q&A for these last couple of minutes and allow you guys to, whether you want to share with us some cool things you're doing this week, or else just give us some updates of what's going on in your state this week. So feel free to come off of mute and share with the group, or any questions you may have that we can answer any questions you have.
Well, Tasha, this is Kim J. from Chicago, Illinois. Let me
Hey,
just
Kim.
say a happy CHW Awareness Week to everyone that is on this call. When I tell you I'm so excited to have the opportunity, a moment in time that is highlighted to explicitly identify the amazing work that CHWs do, it is my honor to be in this space right now amongst such amazing colleagues. I want you to know that you are so appreciated. I put up a chat, a post on LinkedIn saying that CHWs are the diamonds that shine light and also are recognized for their value. That is what I want to say. And over here in Chicago at Sinai Urban Health Institute at one of our safety net hospitals on our North Campus, we are celebrating our CHWs. We're re-highlighting all the things that they've done in the past. Anytime you've identified them for an outstanding job in their newsletters or anything, we've taken all of those and posted them on the doors. So when anybody walks down the halls, they get to see that great work. Also, we'll be doing some tabling in our hospital, as well as a Friday just all out celebration for community health workers. I think my stance on this is to say, you are phenomenal. And it's okay to say that about yourself. And it's not being cocky, it's being confident for all that you do and all the work that you provide to amazing community members who love you and appreciate you. And I want to also tell you, as the board co-chair, that you rock and continue to be connected with NACHWA, because as we elevate, we take you with us. So thank you so very much, Tasha, for this space. And hopefully I've encouraged others to speak up on behalf of the amazing thing that you are, a community health worker.
Thank you, Kim. One thing you did not tell us who you are in the role in which you serve.
Well, my name is, I'll give you the two-pronged approach. I am the training manager, senior consultant, and senior community health worker at Sinai Urban Health Institute in Chicago, which is a part of the research arm of our hospital. In my NACHWA family, I also serve as co-chair of our NACHWA board, and I am on the committee for our workforce development, and I wear other hats on the NACHWA team. But I say all that, I kind of put that to the side because I want you all to see me as a partner in this journey with no highs, no lows, but we're on the same playing field because we're out here doing work that benefits our community, right? And there is no big I's, little U's. We're all in this community together. So hopefully you feel appreciated, if not at your own organization, right here in this moment. I want you to feel so amazing because you definitely are. And oftentimes we don't get the opportunity to tell one another that we appreciate them. So if you don't know what to say about your organization, maybe you could say something about a fellow community health worker that you totally appreciate and you want to give a shout out to, especially on this platform. So if Tasha, if they have space, maybe we can do something like that. But thank you all for listening to me, letting me go on about this amazing week. But celebrate, celebrate all that you are and all that you do every day.
I agree. Thank you so much, Kim J. I also just want to point people to the direction of the chat. We have some amazing links being shared. One of the board members, Ricardo, says become an ambassador. We also have the link in the chat for you to drop what you're doing this week. So anyone else, we have about another minute. Come off of mute and share with us what you got going on this week, or do you want to give just a shout out to somebody?
Hey, Tasha, I'll give a shout out. In the great state of Kansas, we have collaborated with the Kansas City Area Coalition, has collaborated with the area community college, and we're going to have a open house for CHWs to come in, see each other, greet, meet, and a storytelling time. My vision is sort of like a old school church testimonial service. But we look to have a good time doing that. And so I will ensure that some information is being shared. Thank you.
Awesome, awesome. Thank you guys so much for attending today. Thank you, Treva, for letting us know what you guys are doing in your state. We just want to say thank you from NACHWA. Thank you guys for showing up. We want to, before you guys go, if you can, come off of, get on camera because we're going to take a screenshot photo of us. So NACHWA team members, help me get these photos, please. If you guys can help me, if you guys can come on to the camera, and we are just going to snap a couple of photos on the count of 3. 1, 2, 3. We got about 6 pages that we got to snap, you guys. 1, 2, 3. All right, there we go. We got them. All right, you guys. Thank you guys so much. Let me see the hearts. Let me see the hearts. Thank you guys so much for attending, and have an amazing week. Thank you guys.
Bye-bye, everybody.
Tasha, thank you,
Thank you,
everybody. Take care.
everyone.